A biopsy from the upper third of the esophagus shows a lining of stratified squamous epithelium. However, the biopsy also reveals small clusters of COMLEX, mucus glands in the submucosa. What type of epithelium lines the esophagus? The esophagus features a four-layered wall: mucosa, submucosa, muscularis propria, and adventitia. The lumen is lined with protective non-keratinized stratified squamous epithelium, while the muscular layer transitions from skeletal to smooth muscle from top to bottom, with submucosal glands providing lubricating mucus. A gastric biopsy shows large, pyramidal cells with central nuclei and abundant eosinophilic cytoplasm. These cells are located primarily in bata upper calf of gastric glands and stain brightly pink. Which cells are these? Parietal cells, also called oxyntic cells. They're large, pyramidal cells with intensely eosinophilic cytoplasm due to abundant mitochondria. They secrete hydrochloric acid and intrinsic factor. They're found in the upper half of gastric glands, unlike chief cells which are in the lower half. A histology slide shows gastric mucosa with glands that are branched and coiled. These glands contain mostly mucus cells and lack parietal and chief cells. They are found in which region of the stomach? The stomach has three gland types based on region. Cardiac glands are mucus glands near the esophageal junction. Body glands contain parietal and chief cells. Pyloric glands are branched, coiled mucus glands with G cells, but no parietal or chief cells. A duodenal biopsy shows finger-like projections of the mucosa lined by simple columnar epithelium, with goblet cells. At the base of these projections, invaginations extend down to the muscularis mucosae. What are the finger-like projections called? In the small intestine, the mucosa forms finger-like projections called villi that increase surface area for absorption. They're lined by columnar cells with microvilli, goblet cells that secrete mucus. At the base of villi are invaginations called crypts of Lieberkühn. A biopsy from the proximal small intestine shows glands in the submucosa with clear, mucin-filled cells. These glands secrete an alkaline substance that protects the duodenal mucosa. In which specific part of the small intestine? These glands found. Brunner's glands are a defining feature of the duodenum. They're located in the submucosa and secrete an alkaline mucus rich in bicarbonate to neutralize acidic chyme entering from the stomach. This protects the duodenal mucosa and creates optimal pH for pancreatic enzyme activity. They are not found in the jejunum or ileum. A colonic biopsy shows straight, tubular glands that extend the full thickness of the mucosa. These glands are packed with goblet cells. Unlike the small intestine, what feature is absent in the large intestine? The large intestine has no villi. This is the key histological difference from the small intestine. Instead, it has straight, tubular crypts of Lieberkühn that extend to the full thickness of the mucosa. These crypts are packed with goblet cells that secrete mucus for lubrication of solid feces. The surface epithelium is simple columnar with goblet cells. A liver biopsy shows hexagonal lobules with plates of hepatocytes radiating from a central vein. At the periphery of each lobule, portal triads are visible. Which of the following structures is not typically found in a portal triad? The central vein is located in the center of the liver lobule, where hepatocyte plates converge. Blood flows from portal triads through sinusoids to the central vein, opposite direction of bile flow. A duodenal biopsy reveals glands in the submucosa that secrete alkaline mucus to neutralize acidic chyme from the stomach. These are characteristic of the duodenum and distinguish it from other small intestinal regions. What are these glands called? Brunner's glands are characteristic features of the duodenum. A gastric biopsy shows cells located in the gastric glands that secrete somatostatin, which inhibits gastrin release and regulates acid secretion. Which cells are these? Delta cells are endocrine cells found in the gastric mucosa, primarily in the pyloric region, that secrete somatostatin. A pancreatic biopsy shows two distinct components: ketene culture order basing our cells with basophilic cytoplasm, and zymogen granules and pale staining clusters of cells, ketene culture ordered with smaller nuclei. These pale clusters represent which part of the pancreas? Islets of Langerhans, the endocrine portion of the pancreas. They appear as pale staining clusters of cells with smaller nuclei compared to the surrounding exocrine achene. Islet cells secrete hormones directly into the bloodstream.